Do different flu strains explain worse flu seasons? Imagine the flu season as a battle between your immune system and a constantly changing enemy. That enemy is the influenza virus, which comes in many different strains and subtypes. Each year, the dominant strains circulating in the population can vary, and this variation plays a big role in how severe the flu season becomes. Influenza viruses are mainly classified into two types: Influenza A and Influenza B. Influenza A is further divided into subtypes like H1N1 and H3N2. These subtypes differ in how easily they spread and how sick they make people. For example, some H3N2 strains tend to cause more severe illness, especially in older adults. When a flu season is dominated by these more aggressive strains, hospitals often see more cases, more severe illnesses, and higher death rates. Another important factor is how much immunity the population has. If a new strain appears or a current strain mutates significantly, fewer people will have immunity from past infections or vaccinations. This is called antigenic drift. When immunity is low, more people get infected, and the illness can be more severe overall. This is why some seasons hit harder than others. The effectiveness of the flu vaccine also depends on how well it matches the circulating strains. Every year, scientists predict which strains will be most common and include them in the vaccine. If the prediction is off and the vaccine doesn't match the dominant strains well, protection drops. This means more people can get sick, and the severity of the season can increase. Health authorities like the Centers for Disease Control and Prevention track flu activity and classify seasons based on factors like hospitalizations and deaths. Data shows that seasons with H3N2 dominant strains often lead to higher hospitalization and death rates. For example, the recent flu season was considered high severity partly because of the circulating strains and their impact on vulnerable groups. But strain differences aren't the only reason for worse flu seasons. Factors like how many people are vaccinated, how well the vaccine works that year, and the overall health of the population also matter. Age, underlying health conditions, and previous exposure to flu viruses can influence how severely someone gets sick. In the end, the severity of a flu season results from a complex interplay of the virus's characteristics, immunity levels, vaccine match, and individual health factors. Understanding which strains are circulating helps health officials prepare and advise the public on vaccination strategies. The best way to protect yourself remains getting vaccinated each year, as vaccines help reduce the risk of severe illness regardless of the strains involved. So yes, different flu strains do explain why some seasons are worse than others. The more virulent and immunoevasive the circulating strains are, the more likely the season will be severe. But it's always a combination of viral factors and how well we're protected that determines the overall impact. Remember, staying up to date with your flu shot and practicing good hygiene are your best defenses against a tough flu season. Always consult healthcare professionals for personalized advice and stay informed through trusted health sources.